Gabrielle Wilson, and I'm here today to talk to you about parent-child interaction therapy as a potential intervention for children at risk of being maltreated. The identified question, my PICO question, that I wish to explore is as such: among families at risk of maltreatment, is parent-child interaction therapy, also known as PCIT, more effective than a control group at reducing negative parenting behaviors? It is important to study potential interventions such as PCIT because child maltreatment is a great problem in our society, as children are one of the most vulnerable populations. Additionally, it is vastly underreported due to the vast different kinds of abuse that exist. Additionally, maltreatment is multi-determined. It can result from contextual factors such as social isolation, parental factors such as hostility or anxiety or detachment, or child factors such as externalizing behaviors that serve as a catalyst for negative parent behaviors as well. Negative parenting behaviors are a proximal risk factor for child maltreatment. So because if a child is acting out and then a parent displays harsh discipline or commands or criticisms, there's a greater likelihood of maltreatment. So they're correlated even though it's not a causal relationship. Parent-child interaction therapy is thought to be applicable to this population because it is a dyadic intervention that addresses the behavior of both parents and children. So it can cause improvements in children's problematic behavior as well as parents' behavior that is at risk of maltreatment. As such, it is thought to be applicable to parents and children involved with the child welfare system. And it may be a viable alternative to current psychoeducational parenting groups, which, although they've not met extensive testing so far, many of them have not really shown to be effective. So the dyadic nature of parent-child interaction therapy could potentially engage both child and parent in the interaction. The 4 articles that I analyzed were found through a search of 7 different databases through Ovid and ProQuest. The search terms used involved moles words to control for experimental designs, also words referring to my population, such as maltreated children, and then also terms that pertain to my intervention, which was parent-child interaction therapy. So the outcome measure that I was looking at, which is reductions in negative parenting behaviors, was not included in the search because in order to garner more results. So after exclusion criteria were applied, which ruled out studies that explored different outcomes, populations, or were not an experimental design, the 4 final articles were selected. All of these articles demonstrated that parent-child interaction therapy is effective for the outcome measured, which was reduction in negative parenting behaviors. Effect sizes range from as great as 3.5 in Chafin et al. To smaller effect size of 0.54. So they're moderate to very significant throughout the studies, across the studies. The statistical significance of P equals 0.05 was found for all of the outcomes. In terms of the limitations of these studies, no random sampling was used in any study, and the attrition rate was greater than 75% in 3 out of the 4 studies. Also, attrition was different across conditions. Furthermore, blind raters were only used in 2 of the studies. In terms of how I would evaluate this intervention, I would overview the effect sizes that we just noted and also analyze them through the quality of study rating form, through which I found that they all did use randomization and had high statistical significance and also good measurements of treatment. I would also use an A/B single system design, taking pre- and post-test measures and the DPICS assessment of negative parenting behaviors, which is the dyadic parent-child interaction coding system. In terms of implications for treatment, it shows promise in reducing the risk of maltreatment. It has shown to be effective across a variety of demographics, and the main policy implication that I found is that it could be a new intervention to be applied with child welfare clients that might prove to be more effective than current psychoeducational programs. And thank you very much.